Be careful when you are admitted into a hospital because this could happen any and everywhere. So, Yahoo Sports is reporting that mattresses at a Tacoma hospital are oozing fluids. A dispute over damaged mattresses is pitting a Tacoma hospital against some of its nurses and their union. The Washington State Nurses Association says nurses complained months ago that damaged mattresses at St. Joseph Medical Center are oozing fluids. The nurses wanted the mattresses to be replaced, but say it's not happening fast enough. So you guys, that bed that they're showing right there, it was in labor and delivery. Based on the video that I saw and what appears to be leaking out of the mattress is blood. The mattresses were torn and they were fixed but not repaired well. And they were repaired with some sort of tape. But as the women were giving birth, blood was being soaked into the mattress and coming back from underneath where it was repaired. So, you guys, when there is any type of body fluid, there are so many diseases that can be passed on that way. And some of them do not have to be on an open wound. Some of them can just go through your skin. So that is very, very dangerous. So back to the article. The hospital blames supply chain issues for the delay in replacing beds and said they have been ordered and are arriving as they become available. The issue was discovered in the hospital's labor and delivery unit. Caring for hospital beds and mattresses has come into focus since the start of the pandemic, when hospitals struggled to keep up with the flow of patients and supply of hospital beds. The WSNA sent out a statement, that's the Washington Nurses Association, sent out a statement saying damaged mattresses with micro tears are a hazard because they can leave beds vulnerable to absorbing blood and other fluids from patients. The hospital says it regularly inspects all beds after use when they are cleaned and disinfected, and mattresses that do not meet safety standards are immediately removed from service. Well, you guys, as we can see, that is a lie. Those beds are on the floor, and the nurses got fed up with this, and they're showing what's going on. Clearly, you can see that bed is still in service, right? The union contends that nurses informed the hospital about the issue in September, and while some mattresses were replaced, others were repaired instead. A St. Joseph spokesperson said patching is an interim measure until replacement beds can be delivered. Ruth Schubert is the communications and marketing director for WSNA. She admitted it's not a situation that any potential patient wants to hear about. At the least, it's kind of gross. At the worst, it could present a biohazard to patients. Now, we don't have any evidence that any patient actually came into contact with the blood or body fluid that was absorbed in these mattresses, but it remains a concern. We don't have any evidence that patients did not come into contact with it either, said Schubert. The nurses union says it filed a complaint with the Washington State Department of Health. On its website, the Food and Drug Administration has guidance saying hospital beds saying hospitals should remove any damaged, worn, or visibly stained hospital bed mattresses. The FDA guidance also says to immediately replace any hospital bed mattress that has stains, damage, or wear to reduce the risk of infection to patients. The WSNA says the problem of compromised mattresses was first reported on September 8th. So they reported it on September 8th, and they still haven't replaced all the mattresses. And even though they don't have replacement mattresses, they're supposed to pull them out of service instead of repairing them. So what do you guys think about this? I think that they should be in lots of trouble. That is negligence. That is just being plain old lazy and nasty and not giving a damn what happens to the next person who's laying in that bed giving birth to their baby. Or it could be all over the hospital for all we know. But it was first noticed in labor and delivery. So let me know what you guys think about this. I have my own story with a bed when I was having emergency surgery in 2018. The bed had an awful, awful odor. It smelled like someone had, gone to the bathroom in the bed. Number two, the sheets were clean, blanket was clean, but the smell was horrendous. And when I came back from surgery, that is when I smelled it when they put me in the bed. And the nurse and my mom were not listening to me. Maybe they thought I wasn't, coherent because I had just come back from surgery. But I threw the blanket off of me and the smell permeated the room. I got out of the bed and the nurse and my mother were both smelling the bed and they liked to pass out from the smell. I took a shower. Now I'm freshly back from surgery with an incision that I wasn't supposed to wet for, I think, 48 hours. But I got in the damn shower. I showered and I was moved to another room. A complaint was filed about that bed. And I don't know what happened after that, but I never went back to that hospital. And you guys, just be careful out there because bodily fluids can pass on diseases that you cannot get rid of, like viral things like hepatitis does not need to enter your bloodstream. Hepatitis B does not need to enter your bloodstream. Blood to blood. It can be absorbed into your skin. No lie. Go read about it. It is the easiest one to catch. And if someone was laying on that bed with that disease and another person laid in that bed, who knows what they could have contracted. So let me know what your thoughts are. Any stories about a dirty bed in the hospital? Let's talk about it in the comments.